If you're a cat owner, what we're about to talk about is one of the single most important things you can learn for their health. We are diving into feline cardiomyopathy, a heart condition that's incredibly common, but also incredibly silent. So let's get right into what you need to know. So I want you to picture your cat right now. Maybe they're napping, maybe they're chasing a toy. They look perfectly fine, right? But I want you to really think about this question. Because the tough reality is, for a surprising number of cats, the answer to this is yes. And look, we're not talking about some rare one in a million disease here. We're talking about roughly 15%. That means about 1 out of every 7 cats has the most common form of this disease, which is called hypertrophic cardiomyopathy, or HCM. That is a huge number. It means this is something that has to be on every cat owner's radar. Now, here's the really tricky part. Cats are absolute masters at hiding when they're sick. So many of them show zero signs of having heart disease until a sudden life-threatening crisis hits. But, and this is the good news, there's now a new framework that gives veterinarians a clear path to manage this risk before it becomes an emergency. And that's exactly what we're going to break down right now. Okay, so first things first, let's decode this disease. To really get how vets can stay ahead of it, we've got to have a clear picture of what's actually going on inside a cat's heart. That word, cardiomyopathy, sounds super complicated, right? But the idea behind it is pretty straightforward. It just means it's a primary disease of the heart muscle itself, and that's the key. The problem isn't being caused by something else, like a bad valve or high blood pressure. Nope. The issue starts in the heart muscle. You know, in the past, figuring out what was going on was tough because we often don't know the deep down cause. So veterinary medicine made a smart shift. Now they classify these conditions by their phenotype, which is really just a fancy way of asking, what does the heart physically look like and how's it working? It's all about the structure. And this really shows the 2 main ways it can look. On the left, you've got hypertrophic HCM, the most common one we mentioned. Think of the heart's chamber like a room. With HCM, the walls of that room get thicker and thicker and thicker, shrinking the space inside. That makes it really hard for the heart to fill up with blood. Now, on the right is basically the opposite problem, dilated cardiomyopathy, or DCM. Here, the muscle gets all thin and weak, kind of like an old stretched-out rubber band. The heart gets big and floppy, which makes it a really, really bad pump. All right, so now we have an idea of what the disease can look like, but the real game changer is knowing where a cat is on its journey with the disease. And that brings us to this new framework for staging a cat's heart health. To get everyone on the same page, veterinary experts created this staging system, from A to D. It's a lot like systems used in human medicine. What it does is create a super clear, logical roadmap. It helps the vet figure out the outlook for the cat and decide on the right treatment at the right time. Let's just walk through it real quick. Stage A is for cats that are predisposed, think certain breeds, for example, but their hearts are still normal. Stage B, and this one's key, is for cats that have the disease, but show no signs. Stage C is when you start to see clinical signs, like congestive heart failure. And then stage D is for those really tough cases of advanced heart failure. Okay, I really want to zero in on this for a second, because this is everything. Stage B. That is the most critical phase for us to wrap our heads around. This is that silent period. The cat has heart disease, you can see it on an ultrasound, but on the outside, they look and act totally normal. This right here, this is our golden window of opportunity. And that's even split this crucial stage B in 2. So in stage B1, the heart has some mild changes, but the risk is low. The game plan there is basically watchful waiting. But stage B2, that's a whole different story. Here, the heart has more serious changes, like an enlarged left atrium. That's a big red flag. A cat in B2 is at a much higher risk of something bad happening. And for these guys, it is absolutely time to act. So the big question is, if a stage B cat isn't showing any symptoms, how in the world do vets even find the disease and figure out what stage it's in? Well, let's take a look at the toolkit they use. The whole investigation usually starts with a good physical exam. Your vet might hear a heart murmur or a weird extra heart sound called a gallop. They'll check blood pressure. Then there are these really helpful blood tests called cardiac biomarkers that can give a hint that the heart muscle is under stress. But all of these things are really just clues, and they all point towards the main event.
And that main event is the echocardiogram. I mean, this quote from the experts says it all. An echo, which is just an ultrasound of the heart, is the undisputed gold standard. It's the only way to actually see the heart, to measure the walls, to see how it's pumping, and to confidently say, okay, this is what we're dealing with.
So once the vet has a diagnosis and knows the stage, what's next? Well, that ABCD system isn't just for diagnosis. It also gives them that clear roadmap for how to manage the disease, from just monitoring all the way to medication. And you can see how perfectly logical this is. In stage B1, the goal is simple. Just monitor. But once a cat hits stage B2, the goal shifts to being proactive. It's all about preventing blood clots and trying to delay the onset of heart failure. Then, of course, in C and D, the focus becomes all about managing symptoms and keeping the cat comfortable. And here's a perfect example of what that proactive care in stage B2 looks like. One of the scariest things that can happen with this disease is a sudden, painful, and often deadly blood clot. So, for cats that are identified in that higher risk B2 stage, the guidelines now say it's time to start a medication like clopidogrel to help stop those clots from ever forming in the first place. It's a huge step. Now, the vets and their team have their tools, they have their roadmap. But I've got to tell you, the single most important part of managing a cat with heart disease long-term, it doesn't happen at the clinic, it happens at home. And the most important tool? Well, it's you. So what is this all-important job you have? It's actually incredibly simple. For any cat that's in stage B2 or beyond, the experts say the best thing an owner can do is monitor their cat's breathing rate while they are completely asleep or at rest. It is the most sensitive early warning sign that something might be changing. And here it is. This is the magic number you need to remember. Less than 30 breaths per minute. That's it. All you have to do is count the number of breaths, that's one rise and fall of their chest, for a full minute while they're sleeping. If that number starts to consistently stay above 30, it could be the very first sign that fluid is starting to build up, and it gives you a heads up to call your vet before it ever becomes a crisis. You know, dealing with a silent disease like this can feel so daunting. But what we've seen today is that there's a clear path forward, all thanks to early detection and proactive care. And it really all comes down to this one question. Could something as simple as watching your cat breathe while they sleep actually change their entire future? Well, according to the experts, the answer is a definite, resounding yes.